All right, so last time we talked about homeostasis, we talked about what it means, talked about some examples. So homeostasis, as we said, is keeping balanced conditions, providing everything an organism needs. And so when we think about human body systems, that's where we're going to put our focus. All of our body systems, our respiratory system, circulatory system, digestive, the purpose of all of them is to help us maintain homeostasis within our bodies to keep us living. And so we're going to talk about these different systems sort of one at a time. We'll talk about how they help us to maintain homeostasis. We'll talk about what are the organs that allow that to happen. And we'll talk about what are some diseases, disorders, breakdowns that affect that system. So we're really focusing on the body systems here in this next section. So what are we looking at here?
The lungs.
Those are lungs, right? Those are human lungs. And so I think sometimes people imagine what are the lungs like, and they think they're like balloons, just like a hollow container that inflates and deflates, but they're not really structured like that. The lungs are actually made of these clusters. They look like, I think, grapes or broccoli. Like there's a bunch of what we call air sacs. Alveoli is the name for them. It's a whole cluster of those. And each of those is a small little bubble that can inflate with air that we breathe in. And so obviously we have two lungs, a right lung and a left lung. They're both composed of these little clusters of air sacs. And then surrounding these little clusters is a whole bunch of blood vessels. Capillaries. Yeah. And those blood vessels, as we breathe in, we inflate these tiny little air sacs with air from the atmosphere. When these little air sacs, each one fills with that air, those blood vessels surrounding them, those capillaries, can then absorb oxygen from that air because of diffusion. Because as we breathe in air, what we breathe in has a high concentration of oxygen compared to our blood. And so as we know about diffusion, oxygen molecules are really small. They can just diffuse through these alveoli into our blood, where they can then be distributed throughout our body. The opposite happens for carbon dioxide. Our blood is carrying waste carbon dioxide from all parts of our body. And in these capillaries that are surrounding the air sacs, carbon dioxide from our blood diffuses into the air that they're filled with, and then we can exhale that carbon dioxide. So this process of diffusion that we just finished talking about is really important. It's how oxygen gets into our blood and how carbon dioxide gets out of our blood, just due to diffusion. So if we consider our respiratory system, obviously we can breathe in through our nose or our mouth. They're both connected in the back of our head, right? If you're choking on a piece of candy, can you just then breathe in through your nose and then you'll be fine? Depends. No. Because where something gets stuck is after those two passageways merge. So the nasal cavity comes down. Okay, your trachea starts here. So they merge here, and if you're choking, you get something stuck below that. So our nasal cavity, you have nose hairs, you have mucus, snot, has a purpose. Its purpose is to trap and filter out little things in the air that we breathe in so that it doesn't get into our lungs, or less of it gets into our lungs. From there, the air we breathe in goes into our trachea, our windpipe. It goes through your neck. Okay, it's what you could feel as you're talking right here. And your windpipe, your trachea, is ringed with cartilage, really strong tissue. Like your ears are made of cartilage, and your nose is made of cartilage. it's a strong but flexible tissue. And our trachea is lined with rings of it to help make sure it stays open. Because obviously you need to be able to get air into your lungs in order to stay alive. That trachea also has mucus. It also has hairs in it that can filter out little bits of stuff from the environment that we breathe in. There's a little flap called the epiglottis that closes to cover our trachea when we swallow food so that no food goes down there. If food does go down your trachea, I mean, if it's a big piece of food, you could choke. It could completely block the passageway of air into your lungs. If it's a little bit of food or if it's a little bit of water, what happens?
Cough it out.
You start coughing, right? And that's your response. It's your body's response to expel this thing, because really it should just be air going into your trachea. And if other things get in there, then you cough to try to get rid of it.
You ever seen those videos where like kids inhale like squeakers on dog toys?
No.
You haven't?
No.
Every time they breathe, it's like
Really?
yeah.
Sounds like a hoax.
No, it's not.
So as we breathe, air goes down our trachea, and then it branches off into two big branches. We can see here. They're called the bronchi. One here. And then that splits into smaller and smaller tubes. Bronchioles, they're called. And eventually they end at those little air sacs that we saw. Those air sacs are called alveoli. They're very thin. They're very delicate tissue. And they're surrounded by capillaries, as we see here. There's like 300 million of them in our lungs. And they don't actually have any muscle tissue in them. They can't just like contract and expel air. We could see, this is an important diagram here. We could see what I was just describing. So the air comes in. These are like a cross section looking into those air sacs. Air comes in. Here are the capillaries surrounding them. Oxygen diffuses into our blood. Carbon dioxide diffuses out of our blood. And that's how we have that gas exchange, allowing us to get the oxygen we need and get rid of the carbon dioxide. The muscle that actually allows us to breathe in and out is the diaphragm. Your diaphragm is like tucked up under your rib cage. It's like a thin muscle. It's a sheet of muscle. Let's see it here. And basically, when we contract our diaphragm, it creates a vacuum in our chest cavity. And that brings air into our lungs. When we relax our diaphragm, it creates high pressure when we exhale. So the process of breathing in and out, we do that using this muscle called our diaphragm. Sometimes if we get a sudden jolt, it can be temporarily sort of stunned. What's that called?
Like get the wind knocked out?
Yeah, that's when you get the wind knocked out. If you fall, or if you're playing sports and you get hit hard, and it's all of a sudden you can't breathe, right? It's really scary because you're like, I can't breathe. It only lasts for a few seconds, but your diaphragm has sort of been temporarily sort of stunned, and so you have that feeling of you can't breathe. And obviously it goes away in a few seconds, but during those few seconds it's scary. Or if we get the hiccups, okay, is sort of a convulsion of our diaphragm causing us to make that sound.
Why do we hiccup?
Why? I don't know. And I don't know if scientists actually know why we hiccup. Or really why we yawn. Or why yawning is contagious. Like if somebody yawns, right, and you hear yawning or you see yawning, it makes you want to. I know you're trying to hold back, but you want to. But yawning is contagious. It's kind of weird. about why that might be. Even watching like videos of people yawning makes people yawn. No. Our diaphragm allows us to breathe in and out. If we don't think about it, it just happens on its own, right? It's under automatic control. But once you start thinking about your breathing, then like you have to control it, right? You have to like.
Weird.
I know it feels weird. Sometimes like, oh, I should breathe in.
We did these like breathing exercises in Mrs. Hamilton's class, and I was like, I felt so weird afterward. I was like, oh, that's so weird because she was telling us when to breathe, and it was so weird.
So when we don't think about it, we just sort of breathe at a natural rate. We can change our breathing, and change your breathing can affect your body as well, and that's what those breathing exercises are meant to do. So let's talk about some disorders of the respiratory system. Bronchitis. Probably lots of people have had bronchitis in the past.
My sister did.
What is it? The name tells you. Any itis is inflammation. And so inflammation of the bronchi, that's what bronchitis is. Remember, the bronchi are the tubes that split off from our trachea. And so they can get infected with bacteria. Fluid can build up. Okay, they can become inflamed. It's hard to breathe. You cough a lot. Those are the symptoms of bronchitis.
Isn't it like?
You can see it here.
What happens when you get is bronchitis like COVID, like a respiratory disease?
It's a respiratory disease, yeah. It is. I mean, COVID's caused by a virus, and usually bronchitis caused by bacterial infection. But yeah. Asthma. Asthma is somewhat similar in that it's inflammation of the bronchioles, of these smaller tubes. And so in a normal airway, those tubes are sort of wide open. You can see it in this diagram, maybe not. So you can see nice open airway that brings air down into the alveoli. Sometimes, for some reason, people have asthma, and the wall of those bronchi can be inflamed and thickened. And so you see that in the second picture. And so obviously it's more difficult to get air through this tube into the alveoli. But if then a person with asthma, if they have an asthma attack causes muscles that are around these bronchioles to constrict. And you can see that's this third picture. And there's an even narrower passageway to bring air into the lungs. And so it makes it more difficult to breathe. And an asthma attack can be caused by lots of different things: stress, environmental irritants, breathing in particulates and air pollution. Some people have exercise-induced asthma, where when they're exercising, they can have constriction of those bronchioles. And so what is usually the treatment if a person has asthma? Yeah, an inhaler. And what the medicine in those inhalers are usually, they're called bronchodilators, which should make sense, because what does that mean? Bronchodilator. What does it mean to dilate something?
Make it bigger.
Yeah, to open it up. And so these medicines have an effect on your airways, causing them to relax and open up to sort of undo this process that led to difficulty breathing. There are some inhalers. The medicine is something you take daily. Like you just take it in the morning, and it helps just in a general way keep your air passages open. There's also emergency inhalers, which are for instances when you're having like an acute asthma attack. And there are different medicines in them. One can help open them up more quickly versus trying to maintain them all day.
Is that what happens when you have shortness of breath?
It could be. It doesn't necessarily have to be. Sometimes it's due to your carbon dioxide levels if you're hyperventilating, or if you're breathing really shallow, if you are having anxiety, can cause those things. So it doesn't necessarily, shortness of breath could be caused by that, or it can be caused by lots of other things, like heart conditions as well. There's a lot of things that have the symptom of shortness of breath. And pneumonia. Pneumonia is another disease caused by inflammation of the lung tissue. And in these situations, mucus can build up in these air sacs. And if they're filled with mucus or if they're congested, it makes it more difficult to actually get oxygen into your blood because there's not enough air going into those alveoli. Pneumonia can be caused by bacteria or viruses, chemicals, heart failure. There's lots of reasons why fluid could build up in those alveoli. Anyone ever have to use one of these things? These measure your respiratory output, and they can help a doctor measure if your airways are constricted or how well you're breathing. My daughter used to go for allergy shots, and she would have to do this every time to sort of check her respiratory functioning as she was getting her allergy shots. But it's used for lots of different.
Don't they use those after like surgery?
Sometimes, yeah, they do, just to check your breathing's okay. All right, let's try and finish up. Emphysema is a disease when the alveoli kind of get stretched out, making it harder to breathe. Could be caused by environmental contaminants, especially smoking can cause emphysema. The long-term effects of inhaling that cigarette smoke can cause the alveoli to sort of lose their elasticity and they don't stretch and recover as much. And it's typically irreversible. And finally, cancer. Any type of cancer is our own cells that are growing out of control for some reason. They're reproducing, forming tumors. And lung cancer is the most common type of cancer in adults. It can also develop in mouth. People that use chewing tobacco especially can have higher incidence of mouth cancer and throat cancer. Smoking is the number one risk factor for lung cancer. And you can see the differences in the lungs when you look at these two. All right, we'll go on to digestive system tomorrow.
What's this unit called? Are we just like looking?